Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department doing our COVID-19 update for the week. It's Friday, January 28th. You can check our website, falmouthma.gov. Also, that website will work if you want information. We are going to open, just got some information. I don't have a slide or anything, but the shelter will be open for the storm starting tomorrow morning, and some information will be coming out shortly on it. So Falmouth High School will be the place. We'll also have a warming station, warming area at the rec center as well, at the Gus Candy. But the shelter will be opened up tomorrow. I don't have any information. It's not really what I do, but information will be forthcoming on that. And the website should be updated, so the same website at falmouthma.gov. The health department's email is health@falmouthma.gov, and our phone number is 508-495-7485. So today, as of January 27th, there are 3,845 confirmed cases. These are PCRs. These are not home tests, rapid tests. There have been 131 confirmed PCR tests. Actually, not January 20th. I should have changed that. That's January 27th. So this week, it was 131 cases with 32 probables. Both of them are much lower than it was the previous week. Our 14-day incidence rate dropped to 96.2, which is still quite high, but it captures it's from 1.9 to 122, and we had a better week since then. So it's got some of the later in January lowering of the case counts, but it also captured some of the really high numbers. So it's down from 154.8 to 96, and I would expect with the trends that we've had over the last week that would continue to go down, which is good. Our 14-day positivity rate, which is the same time period, the 9th to the 22nd, dropped from 19.65 to 15.8. Same thing, I would think both of those are on a downward trend, which is good. So if you look at our weekly case count that we do every week with the blue dots, you can see it's just as quick as it went up over 3 weeks. In the same 3-week time frame, it's gone down to getting close to where we were. So that's if you want to see what a classic spike looks like, that's definitely a spike. Due to Omicron, and hopefully, and again, this does not count, this is just PCR, so the numbers of real cases since home kits are going to be higher than this, but it gives you an indicator, PCR will give you an indicator that whether the case counts are higher or lower, we're trending backwards, back down, which is good. Yeah, actually quicker than I had thought. This chart here, the flatter the line, the dots are, and the closer they are clumped, the better we're doing. When they spread out and go high like that, you can see on the far right, those are bad weeks. And you can see that we had a better week, so the dots are closer together and starting to trend a little bit sideways. And that's what we're hoping for. Again, this wave, hopefully it's the last wave of the winter, but who knows? And that's what we are with the cases. Counties seeing the same thing, the spike, and then on the far right, you see the 3-day totals of 500 and 700 when 1,200 was. So similar numbers on the county. Deaths, we had a very high number, similar to what we were getting in 2021 at the same time period. Still, generally speaking, lower, with the cases being, 4, 5, 6 times higher, whatever it is, again, coming up here. This would be the numbers that we were getting in 2021. PCR was what most people knew to find out they were positive. So these numbers are PCR way up in the far right. But home kits are probably double, maybe even triple, or some number, I have no idea, that are higher for this. So, again, a lot more cases, but hospitalizations and deaths are sort of similar, actually lower up until this particular week. Hospitalizations are similar for basically the whole month has been in the teens for Falmouth. 53 for a total case of 53, 60, 65, 57, but not. There hasn't been the same spike that you saw with the total number of cases. This slide is the exact slide from the same time period last year. You see right around that same time period, we were not too dissimilar, maybe 19 and 3 one particular week, 10 and 5, we're 15 and 4. So not a whole terribly different from hospitalizations were previously with a lot less cases, mainly because of vaccines and boosters. Boosters definitely help. I can see it when I look at the cases. If I randomly grab 25 cases, there'll be, half of them or more will be unvaxxed. There'll be a few that will have been vaxxed and boosted. That definitely happens, but not proportional to the amount of unvaccinated or partially vaccinated or even vaccinated without boosted. So definitely would encourage you to get the booster, especially since you've committed to the first 2 doses. And our vaccination rate is around 50% for boosters. So Going into the state, this last week when I did the chart was like 14,000. Now we're at 8,000. So the trends are all going down, which is great. So seeing a similar spike at state level for all towns and cities in the state. Our incidence rate is 96.2, sort of in mid-range where we usually are. We're probably a little lower. The state, we're about half of what the state is. We're somewhere better than Barnstable and Yarmouth, somewhere lower than the Outer Cape. So, we're sort of in that middle where we generally are sort of in the middle to the lower end, sometimes a slightly higher end on daily incidence rate. Again, incidence rate means if Falmouth, all these towns all had 100,000 people in them, they would be averaging 96 daily cases if we had 100,000. So that means we're getting, that might be somewhere around 30 daily cases for that time frame. Positivity, we're somewhere right a little bit higher than the state, and better than some of the towns and not as good as other towns as far as our percent positivity. This chart I always like to show, this is fully vaccinated people. So since the beginning, since they started to report this, 394,602 breakthrough cases in the state, which is 7.6% of all vaccinated people have had a breakthrough case. Of those 394,602, 5,885 or 1.49% hospitalization. That number continues to drive lower. It indicates Omicron's not as strong as what we've seen previously, both in COVID, original version of COVID and Delta. Hospitalizations were much higher. And our deaths among those that have been fully vaccinated is 0.38%, or roughly one third of 1%. Among those that have been vaccine boosted. So that tells you that the vaccine and booster work. So if you had to get COVID, it's not generally going to require hospitalization or worse. Our vaccination rates are still robust. We had about 721 total shots, 464 boosters, 97 second doses, 160 first doses. So you still have, a fair amount of people still electing to get vaccinated for the first time. You see our numbers here. Our boosters are about 58% of fully vaccinated people in Falmouth have been vaccinated. 46% of our total population. Our booster rates, I still think, need to be better. I mean, if you committed to the first 2 doses, I would like to hopefully get the booster. So that's where we are again with vaccinations. 95% of all eligible residents have at least elected to take 1 dose. So it's pretty strong numbers. Though going back, you'd like to see it always seems to be a 7 to 10% drop from first to second, and then second to booster, you're also still seeing a drop. So it is what it is. Vaccine availability, again, vaxfindermass.gov. Had someone I know just get one the same day. They went on the Vax Finder and found a pharmacy that day. We just did a clinic. We were fairly full, but we were not completely full at the clinic. We'll do another one for boosters. Barnstable County Health Office is Wednesday 10 to 4, PD between 2 and 4 that same day. Cape Cod Community College, Sunday 12 to 6, Tuesday and Thursday 8 to 2:30. The homebound, those again, call the health department. We can send somebody out for the VNA relatively quickly. So if someone is homebound and can't make it to the clinic, you would call us at the 508-495-7485, and we would get out there, have somebody from the VNA get out there. So that's where we are with vaccine availability. This chart, tells you when you're after 5 months of doing your primary Pfizer or primary Moderna, you can get a booster. Johnson & Johnson's is 2 months. Again, if you can't schedule on VaxFinder, you can call 211. Okay, and talk to someone at the state. COVID testing, school-based test and stay, which was quite a bear for all schools. Basically made schools into testing facilities. Has been replaced by a pool testing and at-home testing. They'll still be testing symptomatic at the school, but that's being replaced. Convenient MD and the pharmacies still do testing. Falmouth Hospital, the fairgrounds is now using Cape Cod Church, so that's the county. So check their website, Barnstable Counties. Community Health Center, of course, there's home tests. One thing about home tests, they're not quite perfect, especially with Omicron, early or late in the disease. So if you've got symptoms, what I recommend you do is, if you've got symptoms and you test negative, is to wait 24 to 48 hours and do a retest. It's not perfect. The home tests aren't perfect. They're good. They're just not, they're not PCR standard. So would recommend you'd probably get a second test. That's for you if you've been symptomatic. So if you were exposed to someone and you've got symptoms, it could very well have been it. And even if you tested negative, especially if you test real early, you'd want to do a second test. Also, as far as COVID testing to stop the spread, which is a state-run facility at the Melody Tent, which is Mondays 9 to 1, Tuesdays 1 to 6, and Wednesdays 9 to 1. So that's another option for you. Isolation guidance is still the same as it's been for about a month or so now. It's a 5-day instead of a 10-day. So I can skip over that. You can always call the health department if you have direct questions with it. This is also on our website right at the top page on COVID-19 where I put this presentation every week. Just above it, I put the isolation and guidance from CDC. So it's up there if you want to have the details. My VAX Records, you can get that from going on to myvaxrecords.mass.gov. Find my vaccine record, put in the information, just be specific. If it comes out wrong, it might just be because your name, you make sure you know the first and last name, it might be kind of cap sensitive to the way you spell it, just make sure you try to get accurate. If you had, I've heard a couple of things on that. So you want to create this system, and you go from there to get your vaccination records online. A little bit about Omicron. This chart here shows that all the orange would have been Delta, and shows it getting outcompeted with the purple Omicron. So it's 99.8 is Omicron in this region, which is Connecticut, Maine, Mass, New Hampshire, Rhode Island, Vermont. It's pretty much all of what's there. And there is a new, variant coming in that would be the son of Omicron, or daughter, or whatever. But there's another variant off of Omicron. Hopefully, if it remains more of an upper respiratory and retains, or even gets more milder, it would be obviously the goal. It's definitely going to, the original Omicron is definitely more transmissible than Delta. Not sure, I don't have all the facts in for the June. I'll do that for next week. But I would think that the vaccines work just as well as would on Omicron, especially if you've been boosted. Face coverings, again, we're at on 1/11 of this month, Select Board adopted a mask requirement in town-owned properties. That still remains in place. And we'll look at the numbers, and when we get to a point where we're lower numbers, I'd present it back to the Board of Health, and they could recommend taking it off to the Select Board. Schools still require it, and the rest of us would be in an advisory for indoor places in Falmouth. As far as our indicated, we're still on the high side for both of these, though getting better. We're still on high levels of transmission. Hospitalizations has been sort of steady in the teens for Falmouth, and again, our vaccination rates are really good. So case counts are still high, but have significantly tapered off over the last couple of weeks. All the cases are Omicron. Strongly still urge you to wear face coverings, especially on your vaccination status, your health conditions, making the good decisions. Vaccine eligibility is 5 and over. Third dose boosters are always available for those 12 and over. And again, you're definitely more likely to get COVID if you're not vaccinated or not boosted. It does increase. Or if you've gotten one dose in March and you decided not to get any further doses, you're essentially you have some sort of a vaccine in you, but the further away you are from your vaccinations, and not getting boosted increases your risk. But definitely if you're unvaccinated, last time I ran it was 5.7. I'll try to run another one for next week. So that's where we are with COVID. We've had a better week, and hopefully we can continue to trend downward. And everybody stay safe this weekend, and don't forget to check if you're interested in the shelter opening up tomorrow morning. Pay attention to the town's website, and they'll be doing some pushes through the different media outlets as well this afternoon, I'm sure. So everybody stay safe this weekend. Hopefully we don't lose power for too long. So that's all I got to say for this week, and I'll see everybody next Friday.